This is Newsmax TV. I'm Ashley Martella. So much for transparency. During the presidential campaign, Obama promised to make the healthcare revolution totally transparent, fully televised in C-SPAN, and with public input. Nancy Pelosi promised the most open and ethical Congress ever. Turns out none of this is true. None of it happened. The 2,000-page plus healthcare bills were written behind closed doors in the middle of the night with amendments added in the wee hours of the morning. But there's at least one person who knows exactly what's in both the House and Senate bills. She read them both, and we're happy to have her back with us at Newsmax. Betsy McCaughey is a former New York lieutenant governor. She's a health policy expert, has a PhD. She's a patient advocate and a constitutional historian whose writings have appeared in the Wall Street Journal, Forbes magazine, the New York Times, and the New York Law Journal, among others. Nice to have you with us again, Betsy.
Thank you, and I'm very delighted that we have an opportunity to talk about the constitutional issues involved in these bills, because there are at least 10 provisions of the bills that flunk the constitutionality test and reveal the Congress's disrespect, utter disdain, in fact, for the public.
Well, we don't know exactly what the final legislation will look like yet. We have a pretty good idea of what will be in it. Let's discuss some of the most alarming elements. First, the mandate that every American buy health insurance or face a stiff fine by the IRS. Your thoughts on that, please?
That's right. There's nothing in the Constitution that permits Congress to require every American to purchase any product. You've heard some members of Congress say the general welfare clause enables them to do it. But in fact, there is no general welfare clause in the Constitution. The words general welfare are used to limit how Congress can pass laws to tax and spend. But Congress is not permitted to pass other laws to promote the general welfare.
The provision snuck into the Senate bill by Harry Reid and company that certain parts of the healthcare overhaul cannot be changed or eliminated in the future.
That's one of the biggest constitutional whoppers. The fact is that any bill that Congress passes can be modified or repealed by the next Congress. That's the essence of democratic government. The people always have the right to undo what Congress did.
All right, briefly, let's touch on those so-called death panels. The Democrats deny there's any such thing, and they chalk it up to just right-wing rhetoric.
Well, the fact is we can declare victory on that matter. The original House bill, H.R. 3200, included a provision for what we could call the president's end-of-life program, which would have subjected seniors to counseling on how to cut their life short, foregoing hydration or nutrition or other expensive end-of-life care, and instead having an advance directive to limit end-of-life care. But the fact is those provisions have been taken out of this legislation. Members of Congress from both parties heard the outrage among seniors about this, and it was well-founded outrage. Let me point out, however, that there is a real problem in the essence of the Senate bill. On page 149, this bill states that qualified plans, those are the only health plans that will meet the legal requirement to have health insurance. So this is the plan you have to be in. Qualified plans can contract only with doctors who follow whatever regulations the Secretary of Health and Human Services impose to improve healthcare quality. Well, that covers everything in medicine, from whether you do bypasses or stents, or issues in childbirth, or gynecological issues like whether to settle for a pap smear or have a pelvic sonogram. It's everything in medicine. So that one provision, for the first time, would authorize the federal government to tell physicians how to treat privately insured patients.
All right, we've heard a lot about the rationing of health care, especially when it comes to the elderly, which you just mentioned. What specific clauses stick out in your mind regarding that?
Well, again, seniors bear the brunt. For example, on a page 1189, the Secretary of Health and Human Services is authorized to modify or eliminate preventive services for seniors, services currently covered under Medicare. And that provision would go into effect right away, right here in 2010. So the president has promised that there will be no reduction in Medicare benefits, but the rationing is right there in the bill on page 1189.
The American Medical Association has signed on to the Democrats' health care reform, but only a small percentage of doctors belong to the AMA. And you've interviewed quite a few prominent doctors very much opposed to it, correct?
Oh, yes. Most doctors are very much opposed to it for two reasons. The primary reason is that for the first time, the federal government will intrude into doctor-patient decisions. This bill shifts decision-making authority from the doctor at bedside to the federal government. And most doctors simply do not want to have to choose constantly between doing what's right for the patient and avoiding a government penalty. The second reason, of course, is that under Medicare and Medicaid, doctors and hospitals are so underpaid for their services that more and more of them are simply refusing to provide services. They can't keep their offices open because they're so underpaid. And as you heard last week, one of the most distinguished institutions in the U.S., the Mayo Clinic, has announced that at some of its branches, it's no longer going to accept Medicare.
We've heard horror stories about patients, say in Canada, with a deadly disease that have to wait over a year and a half to see a specialist. We've heard of health care withheld entirely from elderly patients with a terminal disease in the UK. What do you know about this?
Well, I'm very concerned about it. Obviously, the data show that seriously ill patients in the UK, in Canada, and in other countries with the government-run health care do not do as well. Let me give you an example. A man diagnosed with prostate cancer in the U.S. has a 99% chance of surviving it. It's not a death sentence here. But in Europe, 1 out of every 4 men diagnosed with prostate cancer dies from it. A woman diagnosed with breast cancer in the U.S. has over a 90% chance of surviving it. She's twice as likely to die from it in Europe.
Well, some say the Democrats' health care plan will result in medical care even worse than in Canada and Europe. Do you think that's possible?
It's plausible. What I'm really concerned about here is that these bills take all the decision-making power away from the doctor and patient and give so much of it to the federal government in the most broad mandate. As I said, the most dangerous page in this bill is pages 148 to 49. That is where the real problem is, because the Secretary of Health and Human Services is given broad authority to dictate how doctors treat patients, even patients with the fanciest private insurance.
Well, polls show Americans overwhelmingly oppose this, and yet it seems the Democrats are out to do it anyway.
That is very troubling, and that's probably the biggest difference between this year's debate and 1994, when once the public saw what was in the Clinton bill, the public said, we don't want this, and the elected representatives in Congress listened. This time around, members of Congress are kowtowing to the president rather than listening to the people back home.
Betsy McCaughey, as always, thanks so much for sharing your expertise with us here at Newsmax.
Thank you.
And thank you for watching Newsmax TV.